Hello, this is Garry Aslanyan, moderator of our panel today, focusing on the role of Canada in navigating current trends in global health and global health diplomacy. Welcome everyone online. Thanks for joining us. We have had an oversubscribed number of people interested in this panel. And we're also doing this panel as part of a course here at the University of Toronto School of Public Health, Dalla School of Public Health, which is an executive course in global health diplomacy. As you already know, School of Public Health is one of the top, if not the top one in Canada, as well as offers a wide range of degrees, including in global health. And the executive course in global health diplomacy is one running in the last 5 years with a lot of interest for that, both with Canadian and global learners. I'd like to introduce you to our panelists that include three eminent and well-known experts, both in global health in Canada and globally overall. So it's my pleasure to introduce them. First, I'll introduce Dr. James Orbinski, who is currently the principal of Massey College here at the University of Toronto, where he's also a professor in the Telemetry School of Medicine and at the Monk School of Public Policy. He also is former head of Médecins Sans Frontières, Doctors Without Borders, and also is a founding director of an Institute for Global Health Research at the York University, which is a sister university here in Toronto. So I can spend a lot of time saying a lot of good things about James, but with that, I will move to Tim Evans, who is currently Vice President for Research, Innovation, and Impact at Concordia University, that's in Montreal. He's also former director and associate dean of School of Population and Global Health at McGill University, also in Montreal, where he was the executive director of Canada's COVID-19 Immunity Task Force. And obviously, Tim was also with WHO and overlapped at some point when I was starting there. So welcome, Tim. Colleen Davison is global health researcher and faculty member at the university in Queen's University here in Kingston, Ontario. She's also the chair of the Canadian Association for Global Health, is a member-based national organization that those working in both Canada and globally in global health are members. So she's also Associate Dean for Equity and Social Accountability at the faculty at Queen's University. So these are our panelists. As I said, this panel is part of our course. I'm quickly going to show those online the room, and people here can wave back to you, and you can wave to them. So here is our group, and they are here to start their course. But I'm coming back to the topic at hand, which I hope will find some reflections and maybe answers, maybe directions, especially for those who are here and who are listening, to help us see what is it that we find ourselves in this particular time, both geopolitically and in terms of rapid change in, introduction of AI, climate change, and really multiple issues, and what is role for Canada, and what is it that we can do or need to do, and how can we do it moving forward. So I'm going to start by asking James if he can give us a bit of a reflection on the overview of the geopolitics at this moment and what you think it means to global health.
Well, thank you. Thank you, Garry. In the very first instance, let me say it's a pleasure, very much a pleasure, to be speaking or to be part of this panel on Canada's role in navigating the current trends in global health. And it's most especially a real pleasure to be among friends and colleagues, Tim and Colleen and Garry. I'm going to give you my early preliminary thoughts, I guess, on where we are. Clearly, the catalyst, if you will, for consideration of the issues here in this panel on global health is very much the recent cuts in U.S. aid and what that means for the WHO, for Gavi, for the Global Fund for AIDS, TB, and malaria, and for many other international initiatives that have taken place and that have emerged with significant financial and intellectual support from the United States. I will point out that the United States from 1945 through to very recently has funded between 25 and 30% of all global multilateral initiatives, not simply in health, but across the full post-World War II multilateral system. Any cut from such a major supporter is deeply significant. This takes place in a broader context, which global health thinkers and practitioners must be deeply, deeply aware of and mindful of. The pursuit of health, whether domestically or internationally, always occurs in a political context. What's happening today, at least from my perspective? Well, very clearly the world is changing. And in my view, we are truly at a hinge moment in our human story. And when we think about, I can wax poetic at great length in terms of timelines, but let me just choose 1945 as a critical moment in the arc of our human story. 1945 was the end of World War II. It was also the beginning, functionally, of the Cold War. From there, the multilateral UN-based system emerged. And the other sort of key markers going forward are the end of the Cold War, 1990, the 9/11, the international financial crisis of 2008, and through to today. Major changes have been occurring from 2008 onward. American hyperpower, as it has been called, started to fray. We also saw the emergence of China as a major economic and political power. We also saw the reemergence in recent years of Russia as an imperialist, expansionist power. And we, with the election of Donald Trump, that has been a true opening of the floodgates of major political change. From 1945, there were really three kind of core concepts that motivated the international order as it emerged. And these were, at least in my view, a commitment to justice and the good, a commitment to the rule of law, and a commitment to the right use of power. And those three forces, like a rope, intertwined to create the context, the political context, wherein major multilateral institutions like the WHO and major informal associations of actors, and I'm just referring there to, for example, non-government organizations and their presence and their power within an international system. Those three ideas really coalesced to create the context within which the pursuit of the idea of global health was possible. With the election of Donald Trump, we have seen a walk away from the pursuit of justice and the pursuit of the good. We've seen a walk away from the rule of law, and we've seen the reemergence of pure power. And power as is exercised transactionally. It's not relational. It's not in pursuit of a common good. It is simply in pursuit of greater power for those who have power. And I would argue that we are now entering globally an age of authoritarianism where the United States, Russia, and China are the three great authoritarian, I shouldn't say great, are the three big authoritarian leaders internationally. And with them are associated various allies that seek to benefit from their actions or their favor. I think we also see now within the West a rift, a growing rift of those who are still very much committed to the pursuit of justice and or the good, who are committed to the rule of law, and who are committed to the right use of power, Canada being among them. We also see that within the West, there are splits that are potentially growing. And I'll just refer to a couple of nations. Hungary, Poland, for example, I haven't seen the results today of the presidential election in Poland, but it's very clear that there is let's just call it a variable allegiance to the EU and to basic Western values and principles and practices. We also see in Europe and in the United States and in Canada the rise of the right and the far right, and in some cases the fascist elements of domestic political constituents. We see this very clearly in Germany, in France, and in many other parts of Europe. And we also see in the United States, most significantly, major changes in terms of how the polity of the United States is functioning under the leadership of Mr. Trump. And there, for example, we are seeing the centralization of power to the administration, to the president's office, the diminution, if not almost irrelevance, of Congress, a walk away from the rule of law. We see that the Trump administration is posing direct attacks on academia, on law firms, on science as an independent, fully independent constituent of the polity. We're also seeing in very, very particular areas, we're also seeing attacks on immigration, attacks on universities themselves and their independence, and attacks on the legitimacy of the judicial system. The fact that the Supreme Court is heavily loaded in favor of the ideology of the right. This is deeply concerning for those who think about the overall stability of the United States as a functioning polity and democracy. So all of this is, I'm speaking in very general terms. All of this is deeply, deeply destabilizing for the international order. What strikes me as the most significant in terms of U.S. cuts to U.S. aid and to multilateral institutions is not so much that there are cuts, but what strikes me more than anything else is the callousness with which these cuts have been made, and the not even indifference to the massive impacts in terms of morbidity and mortality in the global south, but the unwillingness to even consider that such cuts will have and are having, and I'm sure we'll hear from Colleen and Tim about this, will have and are having profound impacts, immediate impacts in terms of morbidity and mortality, and that these have been made without any consideration of alternative structures or alternative ways of pursuing global health. This, I think, is actually the most worrying for me. There's simply no regard for the public good. There is simply raw self-interest. And I can talk more about that if people are so interested. So in terms of Canada, I think it's quite important that we recognize explicitly and without hesitation that it is, and this is the root really of public health, the root motivation for global health, at least in my mind. I think it's quite important that we recognize absolutely explicitly that it is very much a wise self-interest to be concerned about the health and the welfare of others, right? So let me just repeat that. It's wise self-interest to be concerned about the health and welfare of others because it affects us. Now, at its most basic, that is a fundamental concept. It is both a moral concept, but it is also a very pragmatic concept. I put that forward for consideration. I think now in terms of where Canada should go, I spoke a moment ago about the rift, the growing rift within the West. I think we need very much to focus on building alliances within or among like-minded nation states, both within the West and internationally. I think those alliances should be very explicitly focused on the public good and on wise self-interest in terms of being concerned about the health and welfare of others, but also being concerned about the viability of such an alliance. Those alliances, I think, should be focused on trade. They should be focused on security. And they should be focused on the pillars that I have touched on around public health and global health, and based on allegiance to the basic concepts of science, of open, free, evidence-based pursuit of new knowledge. I also think that the areas that we should focus on in broad terms, public health, planetary health, and I will point out that the recent treaty, post-pandemic treaty, took place and reached a good end, not a perfect end, but a good end, without the United States participating in the final months of negotiations. And so that demonstrates to me that it is possible to continue to move forward incrementally and perhaps imperfectly, but it is possible to move forward with a commitment to multilateralism. The other area that I think is very important to focus on when I talk about planetary health is global warming, biodiversity loss, and ecosystem degradation. This has profound, obviously, impacts for public health and individual health, domestically and internationally. Just because the context, the political context of the world has changed, does not mean that the problems that existed pre-January 20 have somehow evaporated. We know that global warming, with all of its impacts in terms of extreme weather events, infectious diseases, and in terms of food security, that these problems continue, and not only continue, but are accelerating. The third area that I would say that we should focus on is artificial intelligence and human society from a global health perspective. And I think without being abrasive, I think within the global health community, we have to sort of drop the euphoria around all things good associated with artificial intelligence. Artificial intelligence is truly, truly revolutionary. And we have between 10 and 20 years to reshape and reformulate the way in which this technology is being used. We need to be very practical, and we also need to be very mindful of the risks that are associated with unbridled growth in artificial intelligence. Let me just conclude my comments by saying that the turmoil that we see now geopolitically is going to continue, very likely, and it very well may get much, much worse. And I don't want to be too dark, but I think we truly are in a hinge moment in the arc of our human story. I would suggest that Canada, under the ideas, some of the ideas that I presented here, take a critical problem-solving approach, and that it focus on the areas where it can have significant impact within the alliance idea that I've talked about. And I think there are many things that we could debate and argue what should be the specific focus. I think we certainly will do that. But I think the strategy, the approach, should be a critical problem-solving approach that enhances the public good and that is committed to some of the ideas that I've talked about. Very practically, again, to drill down even more, I would say that, for example, if we look at maternal child health, this has been an area where Canada's contributions have been really significant. We've seen massive reductions in maternal child health morbidity and mortality because of those contributions. And I'm not just talking financial, I'm also speaking intellectually and in terms of our approach to global health. The other area that I think we may want to focus on is use of mRNA vaccine technology to develop a vaccine for a neglected disease in the global south. And I'm thinking, for example, schistosomiasis would be a very, very interesting and good target, and that we do so in a manner that, again, is consistent with our own values and our own approach, which would mean identifying partners in the Global South with whom we would work and to build their capacity. And for example, South Africa has significant capacity in mRNA technology. So too does Kenya, and an alliance, if you will, focused on vaccine development for a disease like schisto, I think would be a very practical and useful contribution. And then finally, I would say that the multilateral system is fraying, it's atomizing, it is spiraling in terms of its ability to maintain coherence and also its ability to continue to have significant impact. I think within the alliance structure or proposal that I've talked very briefly about, I think we'll have to make choices around which multilateral institutions are the most important. And I think that it would be very important that Canada, for example, among its alliance partners, that it choose a multilateral institution that it will support substantially, as well as maintain smaller support for other multilateral institutions that other members of this alliance would choose as their primary institution. We could think about OCHA. We could think about the World Food Program. We could think about the WHO, but I think the WHO, in terms of its material needs, may be beyond the capacity of Canada to support in a major leadership way. However, that said, it is important that Canada is part of a support partnership for the WHO. So I know that sounds very bleak and dark as a summary, but I think I'm being honest. And I think I'm being also realistic and taking a critical problem-solving approach. Thank you.
Thank you for that, James. Really a lot to think about, and thanks for being very specific and giving some specific examples and ideas. So keep that thought. We're going to come back. Now we're going to hear from Tim. Tim, you recently finalized a report from a Royal Society, Canada's Royal Society, that reflected on what Canada can do in global health overall. Obviously, that took some time to prepare, and it landed sometimes in March or April this year. We also had a new election and new government going forward, that perhaps the report that you've compiled and brought all of your colleagues together came at an opportune time. In addition to what James already said, we also have G7 meeting in June, of which Canada is a member and is actually a host in 2025 at Kananaskis, Alberta. And wanted to hear from you now, Tim, what do you think the way forward can be, building on some of the work you've done and also looking at the current state, and again, narrowing down to what Canada's role can be in navigating these trends. Over to you, Tim.
Great. Well, thanks, Garry, and thanks to you and colleagues at the Dalla Lana School for organizing this, and pleasure to be on a panel with James and Colleen. Let me just say one quick thing in response to James' sense of the very concerning rapid withdrawal of U.S. development assistance, which is shaking the foundations of global health at the moment. What I find impressive is that no other OECD nations have stepped up and said, actually, between us all, the other 40 members of the OECD, we could probably take on a proportionate share of the US withdrawal, and it would not touch our fiscal deficits in any significant way, because development assistance remains certainly much less than 0.7% of GDP. So that's, to me, part of the discouraging story. But let me talk to you a little bit about a report that we did for the Royal Society of Canada, as well as the Canadian Academy of Health Sciences. And essentially, the context for the report was post-pandemic. And we were asked to look at, well, what should Canada be rethinking its role in global health? And I think the panel said, you know, it's not just the pandemic. There are a whole set of other things associated with the poly crisis, if you will, all sorts of challenges that have global dimensions and may be accelerating, you know them, climate change and others. And basically what this is doing is increasing the need for collective problem solving, because these are challenges that no nation is going to be able to solve on their own. And if we don't tackle them, we might not only be worse off, these challenges may finish us off. And so in the context of health, it wasn't just the pandemic, it's issues, equitable access to life-saving pharmaceuticals, it's environmental change, and it's labor markets for health workers that define a growing interdependence in health across the world, and where we need to work collectively to solve those problems. And so with this panel of experts, which I co-chaired with Kelly Lee from Simon Fraser University, we reviewed the last 25 years in global health in Canada. And as James said, we have lots to be proud of, but we also said we can't rest on legacy or laurels. And we need to shift from global health as development assistance to recognize that global health is about interconnectedness of our domestic and global health in the 21st century. And so that essentially the panel was arguing that we need to bring a global lens to all our health and health research investments in Canada. We said the renewed engagement could take place across 4 primary axes. The first was to build on the strength of the bipartisan support for women and children's health, which over the last 25 years, as James identified, has made huge difference. We've more than halved child mortality during that period and have made great strides. And so the first recommendation of the panel was to build on that, but also recognize it as an opportunity to strengthen the front lines of primary care around women and children's health, and to extend our own commitment of universal contraceptive access to the global world, and do that through an upcoming G7. The second area of recommendation for engagement was around a One Health Security framework. And this was to build on the lessons from COVID, but also embrace prospective threats that are not only infectious, with a strong planetary health view, and also an intergenerational view, drawing on wise Indigenous perspectives. The third area of action that was recommended was to revitalize health promotion. And in 2024, when we finished the report, we were celebrating the Lalonde White Paper on Health, its 50th anniversary, which was really something that broke through the model of health equals healthcare and brought all sorts of other dimensions to bear. And we felt that tackling global pandemics of obesity, physical inactivity, and substance abuse are overdue. And if one did that, one could really decrease increasing burdens on the healthcare sector, And so the specific recommendation in this area was to tackle commercial determinants of health. So many of these risk factors are mediated by global multinational industries that can either be agents of health or agents of illness based on the way they market their products. The fourth area recommendation was that we'll not make any progress on women and children's health, on One Health security, or on health promotion if we don't tackle the health workforce crisis. And we all know that Canada's health workforce crisis is actually causing people to die, not getting to emergency rooms or emergency rooms that are not staffed, hospitals that are understaffed. And Canada's solution to its health workforce crisis is to increase immigration and recruit health workers from abroad. The reality is that every country in the world is facing health workforce crises characterized by shortages. And so Canada's 15% of its workforce that are internationally educated and growing reflects problems with regarding the ethical recruitment criteria that WHO recommends. Our panel actually quantified what the annual de facto subsidy is to the Canadian health system when we recruit internationally educated health workers, and it amounts to $1 billion per year. That's a net subsidy to the operations of our health system, and that represents about 2/3 of what we spend on health development assistance. So for every $3 Canada gives in development assistance, we take 2 back through this de facto education subsidy. And so we said we've got to move from an error of omission, because the health workforce has never been tackled as an explicit priority, and move to a win-win situation. Interdependence of labor markets is not a bad thing. We just need to learn how to manage them and manage them creatively so that we can not only have the people, the right people in the right place with the right skills across our health system, but we can also encourage that across other health systems. And the suggestion was, Garry, in the context of the G7 this year, that Canada be a first mover on this issue and make it a global priority. We finished our recommendations by basically saying, how could we take these 4 areas of work forward? And we felt it was being important for Canada to join other G20 countries in articulating a global health strategy. Very importantly tied to that was to develop a research and innovation blueprint, which would allow Canada to play a much larger role on the scientific scientific and stage. This is important, especially in view of the NIH removing its de facto subsidy of research in Canada. We need to essentially increase our investments in health research by at least tenfold, and those investments should be done in such a way that we are very competitive and collaborative on the global stage without being dependent on the United States. The last thing we recommended was the leadership to take this forward. We need cross-sectoral leadership at the government level, and we were recommending a global health ambassador that would have cross-ministerial capability as well as budget to ensure that we get alignment between the global and the domestic on all these fronts in health. So that's where we left it, Garry. I'm going to stop there because that's probably enough. I think most people are asleep now, and it's time to hear from others. Thanks.
Okay, great, Tim. Thanks for that, and also to kind of put it in the current context, particularly with the need to work with the G7, G20, and obviously, I'm hoping some of those who are making those decisions probably as we speak will hear some of that one way or the other. Now, last but definitely not least is Colleen's reflections. Colleen, I want you to give us a bit of a more sense as someone who is chairing an association, and I already heard that from James when he came with his comment about how in our wise self-interest, Canadian global health actors need to really promote global health, not as a global thing for others, but as something for Canadians first and foremost. So maybe if you could really give us a bit of more insight how we can do that in this particular moment, and how we can keep the evidence based in policy and programs. I know many of your members are academics working on these issues in Canadian institutions, and also keeping the role of equity in all of this, and emphasizing the role for equity in going throughout all of this. So I'll invite you to help us with that dimension, please, Colleen.
Sure, great. Thanks, Garry. Yeah, I did write down some of those. Wise self-interest was a quote I took from James. Destabilizing, stay the course, raw self-interest. These are all things that, I sort of echo as well. But nice to be here today. Thanks very much for the invitation. It's really nice to see the classroom and to see folks there learning global diplomacy or strengthening their global diplomacy skills, and lots of people online as well. It's a time for global diplomacy, so I give you lots of props for really centering that in your learning. So I'm the chair of the Canadian Association for Global Health, as Garry mentioned, and we convene, we partner, and we champion for global health equity. We're a national organization, but we have international membership. So the convening, the partnering, and the championing is I'm going to kind of structure my comments today about what we can do in the global health landscape currently as a Canadian organization, but also as Canadians. And I think on the global stage, what Canada can do and be in these three areas. So with respect to convening, from the organizational perspective, the strength that we have to move global health solutions, to share knowledge, to build relationships is really in convening. We're learning to convene better virtually, but the in-person convening is still so critical for relationship building. And James mentioned how much of what we're seeing as examples are not relational, and the relational pieces are being lost. And so this idea that convening would be at the center of all of our actions in global health, getting to know people and understanding that the building of relationships is critical to decision-making, to understanding one another, not so that we can align all of our thinking and all of our values and all of our decision-making, but more so that we can better understand, feel compassion, empathy, and understand why people are making decisions they are, and how to move forward with some kind of shared vision, shared goal. Where are we overlapping? Where can we find those directions forward for the public good? And convening can allow us to do that. It can also allow us to share knowledge across disciplines, sectors, nationalities, cultures, languages. And so it still remains critical. And becoming in relationship with others also allows us to understand knowledges that are better explained in relationship, and also to understand where knowledge may be fake news and things coming forward that we're not able to trust. The building of trust is really critical in a global health, in global health generally. So that's been a center of the Canadian Association for Global Health. We do convene every year a large annual conference that's virtual and like hybrid and in-person and virtual. Every year there's a new topic. There's something that we can discuss. Last year it was polycrisis, Tim, as you know, and this year it's around navigation. It's navigating the path forward. So our meeting takes place between the 24th and 28th of October. And, all are invited to have a platform to communicate, to share knowledge, and to build relationship. The second area that I wanted to focus on was this idea of partnership and how critical Canada is as a partner. Both domestically and internationally, Canada has a huge role to play in partnerships. It's not just the resources that they bring forward in official development assistance or other, it's the example, it's the role model, it's the leadership, and the idea that they're standing beside. And so to lean into this idea of Canada as a partner and Canada as a proud partner in the Global Fund, in the initiatives that historically we have been a partner in and will continue to fill gaps as needed. I think to take pride in that role is really critical. With our development assistance policies around feminist and centering women and children's health, I think it's critical for us to continue that work because there has been a great platform built. Sexual reproductive health and rights are so critical, women's health, so critical to the health of all, to the health of families, to the health of nations. And because we have that bipartisan approach and we have the support of Canadians and all of government, I think it's critical for us to really build on that and to continue that work. Not moving away, not leaning back, but leaning in to our partnerships, the multilateral agencies and partnerships that we currently, there should not be a reduction in our ODA from 2022 to 2023. It should be that we're leaning in further. And that's where we see the direction should be. I think the third area that the Canadian Association for Global Health is trying to be and do is this idea of championing. So championing, deciding what to champion is of course important and difficult sometimes, but to be that champion and to speak and to step forward and to step up is a very important role, and Canada can do that. So choosing to champion women and children's health and championing human rights and championing multilateral agencies and initiatives and championing global health generally, but finding those pockets where it can be more specific is also important. This idea that our Feminist International Assistance Policy is about addressing sexual and gender-based violence, reproductive and sexual rights and health, providing support for local women's rights organizations and movements, helping governments in partner countries improve policies to serve for the differential needs of women and men, and stepping up its commitment to evidence-based decision-making are all really great areas that we've already established and could continue to do more to champion around. The last area, as you mentioned, Garry, about half of the Canadian Association for Global Health membership is on the academic side. And the benefit of that, I suppose, is that it's the convening of people who are doing knowledge creation, knowledge production, research, evaluation, with others who are working frontline and are making policy decisions in government, et cetera. And that's such a valuable space because we're able to share that knowledge, hopefully. And there's a science behind that, right? The science of knowledge translation, the science of the solution in global health. We need to continue to champion for that as well. And the nuance of our understanding of solutions. I think that oftentimes, I know in research, we're very good at minutely dissecting the problem and observing all aspects of the problem. Not every problem gets equal attention, so that's an issue. But I think one of the areas we have to champion is this idea of the science of the solution and the science of the nuanced understanding of root causes of problems, and the solutions may be quite far from a medical approach or even a technology. Many times have to do with policies around economic and social policy at a broader level. I think that when we think about evidence-based approaches, the artificial intelligence wave and tsunami that is on our brink cannot be underestimated. And the dramatic effects of that on every aspect of our lives, I think, is going to, if not evident to most, is going to be evident to all of us very shortly. I think we have to really center the ethical thinking around AI, and I think we also need to be very intentional in our approaches and as immediate as possible in setting up structures that allow us to think intentionally about AI, our use in a public sphere and in all institutions and across our lives. I don't think that we have time to waste in that area. I do think that there's some significant opportunities, but that if we forget ethics and if we forget sort of the intentional thought in its use, that could be quite dangerous. So I'll just close by echoing to say that I do, while I'm thinking convening, partner, and champion are all areas where Canada needs to lean in, I do think that we need a global health strategy, that a unified strategy would help us to articulate where we are, where we're strong, and where we're going, and that would help us to align. I mean, similar to the Millennium Development Goals, Sustainable Development Goals, they're not perfect, they're very ambitious, etc., but it helps people align, and it helps us to have a unified language. It helps us to develop ways to distribute our resources in unified ways. So I do think that a global health strategy is worth the time it would take to put together. And I think that centering knowledge in that and recognizing that there are many types of knowledge, but that we have science and evidence to allow us to understand both problems and solutions is a really critical component. So I think I'll leave it there for now. Thanks.
Great, thanks for that, Colleen, and particularly because if this was whatever we come out of this discussion to work, we really do need to take along, Canadians, both who work in global health or related areas, but also those who work in public health in general, maybe not directly in global health, and all of us in terms of where we go, because if we don't take them along this with us, probably we won't succeed. So it's really difficult sometimes, and we need, I think, some of the ideas you had in terms of championing and in terms of focusing, etc. So all of that is really good for us to keep in mind. I'm going to now, we have questions, but I'm going to now quickly go one more round, very quickly, an answer of 30 seconds from each of you, and then we'll open to questions. So first, coming back to James and asking him why you think we will or how do you think we will be successful in taking some of these messages to be that government or other sort of movers and shakers in Canada to make this a priority for the current situation the country finds itself in, including the need to, revamp the economy and invest more in Canada-wide projects. All of this is is long, but how would we be able to get global health to the ears of those who are currently preoccupied with these questions? Quick response from you, James. You're muted.
I think it's quite important to recognize that the issues that we've touched on here and the practical ones that are immediately before us. So, for example, pandemic preparedness and response, the impacts of global warming, and biodiversity loss and ecological degradation, the very real risk of yet another pandemic. These are risks to us as Canadians, as well as risks to others outside of Canada. So, you know, the idea that all, I mean, Colleen and Tim and myself have essentially implied that we need to move away from global health as a charitable activity that we do out of beneficence or benevolence towards others, and that make us feel good. Global health is about us. It is very much, and it's about others. And this is why I really emphasized it is wise self-interest to be concerned about the welfare of others. Now, we just simply need to continuously reinforce that argument. We literally must move away from this really silly idea that global health is a charitable activity. It is not charity. It is about all of us. Garry, I just want to correct a comment that you made in reply earlier to some of my comments.
Yeah.
Said, yes, why self-interest is very important. And then you said, primarily for Canadians. That is not what I'm suggesting. Why self-interest is for all of us. And if we do not understand that, then frankly, as a global health community, we are failing to communicate that effectively. So we have to find ways to very effectively communicate that basic concept around very practical ideas to our leadership, our political leadership, and also to the wider Canadian public.
Okay, thank you for that. Tim, I'm going to ask you to tell me why you think, well, build on what James said, and now with the suggestion you had for global health strategy, why you think this will be hopefully different this time? And what is it that we can do to not find ourselves in 6 to 12 months from now in a situation where some things change, but perhaps we still are struggling? And you and I have talked about this maybe for the last 25 years. So help sort of reiterate, what is it that we need to do differently this time?
Well, Garry, I think we have to realize much more fundamentally that the nearly $500 billion that we spend in our own healthcare system in Canada could be much more efficient if we made effective bridges in very discrete areas to collaborate and problem solve across borders. And so this is, to me, this is, you know, a little bit James' point that this is benevolent self-interest, or however you want to say it. It's that there's more value for us to reform and strengthen the performance of our own health system. And when I say health system, I say that in the broadest sense, not simply the healthcare components, but there's also great opportunity for learning how we can do better. If we look across OECD, Canada is a bottom performer on virtually all comparable measures of health metrics. There's no reason why that needs to be the case. And so to me, where we would be ahead in 6 months or 12 months is we remove interprovincial barriers on health. And start to learn as a country how we can do better, because our citizens are owed it. And part of that learning is making much more effective, productive links with other countries on issues of common concern.
Thank you for that. And thank you for reminding us about the, you know, the global kind of health systems and its need for having the interdependence of all of that. I think that sometimes is also why there is a perceived division between the systems globally or domestically, and that need for interconnected review of global health systems. Colleen, last point to you. You probably see a lot of advocacy done by different groups, including your members, etc. What can we do better in advocacy that will also be different this time, and sort of galvanize it around people together rather than competing for the pet project or specific area, but really pushing for comprehensive and more strategic approach to this. All of you have alluded to that by calling to focus, by calling to kind of get our house together and use this opportunity. Some more reflections from you, Colleen.
Thanks, Garry. I mean, that's a hard tack, but this is not the time for Canada to lean back. It's time for Canada to lean in. It's not a time to reduce the role. So the more opportunities that can be made available for team-based initiatives, for evidence and practice to be combined and funded to do work together, to support partnerships, across sectors, across countries, across topics. I mean, this would all be positive in building our momentum forward. And so, it does help. It does help our efforts if there is a new launch of an initiative from IDRC or Global Affairs, or it helps if CIHR is funding global health work, et cetera. So, from the center of government, advocacy within, and for those who are already very supportive, continue to be speaking loudly within those walls, because it does make a difference. People will change the direction of their research programs if there is more funding and more opportunities. People will build partnerships if it's written into the funding envelopes. So that is one way to sort of see, and it has worked in the past, but we can continue to do more of that. I think communications can be leveraged more and more, and younger generations are just using communications so much more effectively. The social world and video and this virtual world, the way training has rapidly changed since the pandemic, the way relationship building and partnerships have changed because of virtual abilities to meet, et cetera. So I think advocacy shouldn't be bound by some historic practice and historic ways of doing things. I think also partnerships and relationships and teams can really dramatically work better because of the opportunities we have through some of these communication technologies and opportunities through communications. And I think we can also unify our messages and articulate clearly. There's a lot of noise, but if we have effective communicators in global health, that can go a long way.
Okay, great. Thanks for that. Really, this issue of communicators in global health has come back, by the way. So that's really also another theme for all of us to keep in mind as we go. I'm quickly going to see the questions that we have. So we have, I think there was a question about how we can frame the current government's interest in a nation building project. I think that was partly addressed by James. And then there's another question on, while there are cuts to supporting countries to strengthen their efforts in combating diseases, but also how can we make sure that it's not really going to be more dependent on external, but sort of accountability mechanisms are effective to allow greater domestic resources in countries. Who wants to address that? Because this is clearly something will come up, and in our efforts to advocate and communicate this will be one of the things will be asked. So Tim, you have your hand, so tell us.
Yeah, well, I think it's a great question. And I think this is an area where not only the health sector, but the development sector has not performed well. And, we're operating on the Pearsonian model of development assistance. In 1969, we had the Partners in Development Commission of the World Bank that was chaired by former Prime Minister Pearson at that point in time. And they came up with the recommendation of 0.7% of public funding to low-income countries and 0.3% from the private sector. And if countries made those commitments, rich countries made those commitments through to 2000, we would have development for all. That was the clarion. Now we're 25 years past that, the lack of achievement, and we still, in the development sector, are holding on to that prescription from 1969. The world has changed, and we should have abandoned that 5 years after 2000 and come up with a fit-for-purpose development assistance strategy, which focused on the realities of domestic resource mobilization in low and middle-income countries. And this is where current development assistance is performing very poorly. There's very little evidence that it's leveraged domestic resources. There's huge evidence that it's substituted for domestic resources or has been seen as a source of foreign currency that treasuries like to get a hold of. So to me, the benefit perhaps of one of the major partners or the major partner in development saying we're out is that we have to rethink the model for development assistance quite fundamentally. That doesn't mean that we abandon it. It's just that I think we need to bring it into shape for the 21st century and really look at the realities of domestic resource mobilization in low-income countries and recognize that they won't look like welfare states that we grew up with in the post-war period. So I think embracing that harsh reality, most economies are informally designed, meaning most of the people working in those economies have no regular paycheck. Therefore, they don't pay taxes. So any model which says it's going to be a tax-based financing for everything in development is not realistic unless you've got some better solutions that the World Bank has been advocating for 45 years on how to increase tax revenues and tax collection in low and middle income countries. So we need to put it in that bigger context and really bring the best minds to focus on it because it requires innovative solutions.
Okay, so James, you have your hand, but can you also help me with another question here as you take the mic? There is a question that honestly, I've heard this many times. Every time we wrote a piece or article or opinion piece, there always comes back, and currently maybe it's even more acute. The question is, in the time of finances in Canada and situation in Canada, while it's ethically and morally sound to help others, but how do you justify that and how do you balance that with Canadians having to look at their own health? So we've done this, or we've talked about it, but please also reflect on that. Because this is not the one and only question, huh? We hear this all the time. Over, James.
Yeah. Okay, well, very quickly, I just want to follow on what Tim has emphasized. We have to face reality in terms of what kind of context we are in today.
Different, yeah.
The other reality that I agree very much with what Tim has just said. I also would like to just emphasize that there is now massive shift in public spending towards security, right? Towards arms. There is trillions of dollars are now increases have now been allocated in Europe towards arming against a potential Russian threat. In Canada, we must respond to NATO's demand for a 5% GDP spending on defense. We're now spending 1.83%. We don't have, so I don't have any crystal ball about just how much our defense spending will increase, but it will increase. And what that means is that there will be less money for domestic programs of all stripes, including health. And it will mean that there will also be less money for international development assistance and humanitarian assistance and so on. This is reality, right? So what I'm suggesting is, and I think what others are also suggesting, is that we need to make very clear strategic choices in terms of global health and what kind of areas do we focus on. And I think we just have to kind of pop the bubble, or the idea that somehow we live in a bubble, right? That Canada is somehow separate from the world, and that major threats to not simply global health, but our health, that these threats, we're immune from them. We're not. We are not immune from the future pandemic that is going to happen. We are not immune from the very direct health impacts of global warming. We see it today. 2 of our provinces are in a state of emergency because of wildfires. For example, we see massive changes here in Canada in terms of the pattern of infectious diseases and so on and so on. So we have to break the bubble that somehow we're just sort of, we can make choices that protect us and that, well, we'll have a little bit left over for others that will make us feel good. No, we have to change the paradigm, change the story, and make very, very clear strategic choices around global health. And I think, of the ones that Tim, I think, very brilliantly and quite succinctly outlined, the first 2 are just so right. A focus on maternal-child health, strengthening what we have already made major contributions to, and then the second one being a focus on a One Health approach to climate change, biodiversity loss, and ecological degradation. Personally, I have quibbles with some of the emphases within One Health. I prefer, personally, a planetary health perspective, but this is narrative that we have to figure out. But the thrust, the focus on One Health, planetary health, and the focus on maternal-child health, these are very practical areas where we can actually engage in critical problem solving and make a real contribution to other people's health and therefore to our health, right? The other area that I've emphasized is vaccine development. And again, I would like to just keep that firmly in our minds. We have real expertise in mRNA technology at McGill, here at U of T, at UBC, and elsewhere. And we can make real contributions to real needs in other countries. So thank you.
Mm-hmm. Thank you for that, James. I'm going to now ask if any of our learners in the room have questions. I have maybe about 5 minutes left for the session. If you do, please come here. You'll have to use the microphone so others online can also hear you. Please do not be shy. It's okay. I'm here next to you if you have a question. Yeah, Krista? Okay. I think the question from Krista is here. James, it's to you. You mentioned AI as a space upon which the global health field should focus on. What do you see as the greatest risk of unbridled use of AI to global health? Voila.
Well, so I think I'll just cut right to the chase. The bottom line is that artificial intelligence systems are already capable of autonomous decision-making. Independent of human control, independent of human regulation at this time. in terms of my own experience with the use of AI, I have a research program focused on modeling the health impacts of climate change, and we do agent-based modeling. We use AI to assist in our model development and in our variable weighting within our models. What I see as probably the most significant issue, I also see major challenges in direct humanitarian assistance and use of AI systems to maximize the efficiency of the approach to particular decision-making points in humanitarian, complex humanitarian emergencies. So what I see is the major issue is control of data privacy, security, and encryption. There are nefarious actors in the world who are very interested in the data and very interested in the activities of humanitarian organizations and of development-oriented organizations. And we need to, very frankly, stop being naive about this. And we need to ensure that our patients, our populations that we are focused on, that our activities do not, through our ignorance, actually increase the risk to those people. And so we need to focus on developing appropriate regulation and appropriate standards, enforceable standards of conduct and enforceable standards around data privacy and security, and also around data, that data is not itself biased, and that any bias that exists in data is properly recognized and properly weighted and properly accounted for in terms of the outputs of any particular AI system. This is not yet the case. And I'm not sure that given the pace of change within AI, I'm not sure that it's actually possible to regulate in the way that I'm suggesting, but we'll see.
Mm-hmm. So that still remains a challenge in a way. So Colleen, can I come to you now also to reflect more on, perhaps as we are coming to the end, having heard both questions from the audience here in the Learners Forum, as well as those from online, what gives you hope in terms of how we can actually operationalize this? And I mean, a lot is going on. Can you inspire us?
Okay. I do have hope in people. I think the comments today have been really insightful, and I think on a daily basis, I interact with others who give me hope because they maintain steadfastly that we can, be working for the public good, and that where there is a future for our planet, and there is a future for the people on it. There are many days when you have to question that, but the hope that I get from others who are finding ways. I think one of the reasons I tend to try to focus on the science of solutions is because the hope is in there. The evidence around what's working, for whom, under what circumstances, at what cost, who's bearing the cost, what are the implications of solutions. I mean, that's critical for us to understand to move forward, even in small spaces where it is difficult to imagine solutions to large, wicked problems. But the small spaces where you're seeing progress and you're seeing inspiration, that's what gives me hope. With respect to the AI question, there are lots of opportunities, and I think what gives me hope are people who have an open mind to change and innovation, and they're not stagnated. That is wonderful to see, and I think that's a wonderful human characteristic. Of course, there is significant risk, and as James said, the pace of things, I don't know. I mean, our better judgment would be, yes, we should be intentional. Yes, we should have monitoring. We should have enforcement. We should have regulation. can we keep up with the uncertainty of how it's going and where it's going and how people are using it? I'm not sure. And so that's not maybe a hopeful area for me right now, but I'm trying to ring the bell as much as possible wherever I am to say, you know, let's really wake up to this and continue to make structures to work towards a more intentional approach to the integration of AI and the use of it. I think what generally gives me hope is working with others and the idea that Canada could be and still is proud in its value as a global citizen, as a global nation, and that it can take a role to lead in spaces where we are working towards public good and the dignity and human rights of every person. And when I see that happening, that gives me hope. Great.
Thanks for that. Tim or James, one word from you at the end before I wrap up attempt to wrap up and summarize, so to say. Tim.
Well, thanks, Garry. I think the sort of the nasty winds of the Trump administration that are dominating the discourse at the moment will blow over. And we're going to find that the problems that threaten health in Canada and in every constituency remain and won't be any better. They may be worse. And so my view is that we need to prepare now for greater collective problem solving and cooperation on these issues that confront us all so that we can learn how we're going to manage in a brave new world.
Great. Thanks for that. And James, one last word.
Yeah. Louis Pasteur said, when thinking about how to deal with infectious diseases, he said very famously, the microbe is nothing. The context is everything. And so I'm hopeful when we see reality as it is, not as we would like it to be, but in the very first instance, we see reality as it is, when we act with the right intention, which in this particular context is very much about the public good, and when we literally put one foot in front of the other in terms of going forward, and that we do so with a critical problem-solving approach. That is what makes me hopeful and makes me willing and very much committed to putting one foot in front of the other and going forward toward the good.
Great. Thank you so much, three of you. Look at what we've done in an hour and a half. We've covered so much and so really expertly done by you. Great questions. We have identified really the areas where we can do, and in the moment we find ourselves, in the situation we find ourselves. So this was extremely intellectually stimulating, I'm sure, for everyone who joined. We will continue these discussions for us here at Dalla Lana School of Public Health and Center for Global Health. This is imperative to continue have these kinds of dialogues. So again, thank you for joining us, but the panelists, and I'm going to ask the room to give you a round of applause here, even if you may not hear it.